the important thing to emphasize is that almost without exception, anyone that's diagnosed with ALL can be treated with the hope of cure. The likelihood of that outcome varies a lot depending on certain circumstances. We've learned a lot over the years about how to identify which types of ALL are going to be relatively easy to treat versus those that are not so easy to treat. That often dictates a lot of what we expect from the treatment in terms of what the ultimate outcome is going to be, how well the disease will respond, and how likely it is we'll be able to get rid of it. Other factors that we have to consider are the overall health of the person that's afflicted by this disease. The unfortunate reality, even though the chemotherapy often works very well, it's very intense treatment, and it's often very difficult to give to people that are older or people that have a lot of medical problems. So that often, when we have to take those issues into effect, it often affects how likely it is that the treatment is going to work in the end. So not all of the treatment is necessarily has to be given in the hospital, but with some of the regimens that we use, patients often have to be admitted to the hospital periodically just to deal with some of the logistical issues of giving the medication, to a certain extent also to handle some of the potential side effects that can happen in the short term. But generally it's more logistical in nature, either because of the frequency at which the medicines are given, or the intravenous route by which they have to be given, that just it's too difficult to do as an outpatient, these sorts of things.